no matter how good a practice is trying to do, everybody in the typical practice knows that they only get paid if they've checked all the boxes and filled out all the forms and done all this stuff. So much of everybody's time, from the person that checks you in to you talk on the phone, and so what's your insurance, what's your insurance information, all this stuff, everybody's doing that. When you come to an office that doesn't have to deal with that, the only thing everybody in this office cares about is getting you better. That's it. We don't care about anything else. And people feel it. They can tell it, from the time that they are talking to the staff on the phone. They're just asking them, how fast can we get you in? What are your needs? How can we get you better? How can we accommodate you? If somebody calls, 99% of the time, somebody's going to answer the phone, and they're not going to get on some message machine. And if you do, somebody's going to call you back right away. You're not calling a doctor and then you wait for 2 days to see if somebody gets back with you. It's just a whole different thing, all oriented around patient care.
Welcome to World of Marketing Podcast, a Foster Web Marketing production. Here's your host, Tom Foster.
Hey everybody, it's Tom Foster. Welcome to the World of Marketing, where I interview clients and great people in this industry. And today I've got my good friend and client, Dr. Joel Foster. I'm really excited to have Joel Foster here today. And I've also got John Spare here, who does the marketing for Joel's website. And we're going to talk today about Joel's cash pay system that he created after years and years of dealing with insurance company nonsense and needed another channel to make revenue that was much more profitable. And he's gone to this cash pay system, which everybody needs to go to. And that's really what this is about, is that you don't need to be afraid to go to it. We're going to talk about how Joel did it. So with that introduction, Joel, thank you so much for taking the time. I see you got your gear on. You're obviously right in the middle of your day.
Yeah, I'm here right in the clinic here. But we've got some time set out to take care of this, which is great. I really appreciate you having me.
I appreciate you. And, I appreciate the fact that you're willing to sit down and help other doctors and help us, to get better and help, you've been very involved in the marketing process, right, John?
Absolutely.
From the get-go. So let's talk about where you were. Talk about how you built your practice. Let's start there.
Well, I started whatever it's been 23, 24 years ago now in private practice. And actually, I started working for another doctor, and then after a few years, ended up going out on my own. And my wife and I actually started the practice. She's been the practice manager since day one, since we did this. And, honestly, we didn't know what we were doing. We just knew we wanted to help people get better, and we were going to try to make it happen. And slowly we built and grew, and it was really, really good as far as from a patient standpoint, as far as we were getting new patients in, we were seeing people, we were helping them get better. But we just were struggling so much with really watching patient care go downhill, not because we wanted it to, but as years went on, the insurance companies demanded more and more and more. And pretty soon we found ourselves, now we're, spending more time checking the right boxes, asking the questions the insurance company wants, trying to document it in the words they want it to, and less time actually treating patients. That was one problem. The other problem is that as the insurance companies demanded more and more of our time, now we're having to hire more people to make sure everything's getting checked off right. And now our overhead's shooting through the roof. And the only thing that you can do from a business standpoint is if your net profit per patient is continuing to go down, is to see more and more people a day. Well, when you're forced to see 40 plus people a day, how good of care can you
Yeah,
really
the
be
quality
giving
of
those
care goes down.
patients? Yeah,
Yeah,
it's just, and so that was really our driving factor is when I came into business for myself, I said I wanted to treat every patient in the chair like they were my mom, my dad, my brother, my sister. What would I do with them? And how would I want to be treated? And I would never run in and out of the room in 5 minutes with my mom sitting in the chair. Yet I'm finding myself doing that with every
yeah,
patient because I have to see so many people a day. And that's when we finally said, we just have to do something different. We got to stop. We got to do, we got to make a change. And believe me, we have gone to, seminars and talks and you name it, and watching people do everything. And there's a lot of innovation out there. And I think a lot of people are doing some very good things to try to combat this. But to me, it's almost an ethical issue at some point when you see that the insurance companies are taking advantage of patients. They're charging them all these premiums. The patients aren't getting the care they need. They're having to wait to get into people. At some point, you just have to say, you know what? I don't think that's right. I believe that's the wrong way to do it. And there's got to be a better way. And so that's how we got to our direct care model, where we said, you know what? We're cutting all of that out. We're going to make this simple. We have an upfront, very reasonable cost. We're going to put it out there on the website. Everybody knows before you come in what anything's going to cost you. You can come in, you can have an exam, you can have a set of x-rays if you need it. We can go through every single option of what, things are available to help you get better, what the costs are. And then you make a decision. It puts the decision making back in the hands of the patient instead of the patient having to, they go to the doctor, they go sit in the waiting room for an hour. They see the doctor for 5 minutes. They run all these tests. They don't even know what happened. And then a month, 2 months, 6 months, a year later, all these bills are trickling in. The patient doesn't even know why they had it, let alone what they're for half the time. And if they knew, they would have said, well, if I would have known this was going to cost me this much money, I would have not even done that.
Bills from the insurance company, right?
Right,
That's what they get. They get more bills from the insurance company on top of the premiums that they pay.
Exactly. So you're paying, and I can tell from when I had traditional insurance, I had a huge monthly premium. And then on top of that, you have a deductible of some amount, which is at minimum for most people, $5,000. Most is $8,000 and up. And then on top of that, then even once you meet that deductible, which most people never do unless you have something significant, but even once you meet the deductible, then you have a 20% typically co-insurance until you meet an out-of-pocket max, which is some other crazy high number. So for most people, I consider all of us uninsured until we've met a deductible. That's the reality.
Insurance companies are just eating themselves up, man. They are so greedy. I mean, it's ridiculous how they have just manipulated the whole system for themselves at the sake of patients.
It really is. And again, that was the patients was our number one. We were like, we have to provide. I want to treat somebody like I would want to be treated. And I want somebody to sit down, explain to me what's going on, help me understand my issue. And we've been able to do that. We really have. And it's just been, it's been huge. Like I can tell for myself, not only am I seeing the patients just how much better they're responding, but I feel better. I feel like I'm really being a doctor again. I'm not processing people. I'm treating patients.
Yeah, so if I can make an aside comment on just real quick based on what Dr. Joel said. When I first met Dr. Joel, and it wasn't really that long ago, it was about four months or so ago, I knew he was different. I knew him and the whole team there, Hannah, Julie, Michelle, everybody was different because the first things out of his mouth was like how much he wanted to, like provide for the patients, and that really resonated a lot with me. And as I've worked more with Dr. Joel, I've learned that it's not it's, yes, he wants to provide for the patients, but he's also looking out for their financial well-being too with this direct care model, which is something that I really took to heart, moving forward with Dr. Joel. But I just wanted to point that out. Everybody hears direct care and they're thinking, oh, it's some type of a ruse to put more money in the doctor's pocket. That's not it at all. Like Dr. Joel explained it very well. He has the ability now to give the type of service that he wants to give to his clients, and it's not rushed. And he's actually, from a financial standpoint, like it's better for them, than dealing with the insurance.
It's better for everybody.
Yeah, absolutely.
Insurance company.
It really is a win. It's a win, yeah, except for the insurance companies. But like, for example,
it's a way to stick it to them, man.
Yeah, that's right. That's right. I mean, it's really the only way. I look at it like this. When you're in the medical field, I've not seen one doctor ever go, I really love these insurance companies. They're great. Like nobody ever says that, because that's what everybody's like. That's what
I love. All these coding. I love doing this coding.
It's stupid, but at the same time, to me, I look at it like this: like we keep doing it. Like we complain about it constantly. The insurance is horrible. They do this, that. It's all awful, but we keep doing it. I say it's like this: if you went to a restaurant and the service was awful, would you go complain about it and then just keep going back over and over again and just keep paying more and more money? Of course, you're not going to do that. You're going to find somewhere else. But when it comes to healthcare, for some reason, doctors and patients, we just keep complaining about it, but we keep going back and doing the same thing and wondering why it doesn't change. Well, it's never going to change unless
it's only gotten worse. It's only gotten worse.
The problem is, and this is where we're running into, like, how do we solve the problem, is most people don't know there's another option. That's why they keep going back. And that's where the marketing and the strategies come in, because we're trying to offer something to people that either they don't know exists or don't know how to find it. And, sometimes it's easier when you're like, okay, I have, product X and everybody wants whatever, a car. How do I make my car better than everybody else's? But we're offering a different way of healthcare that most people don't even know that they should be looking for. And once they find it, they don't really even quite get it, because all of us, our whole life has been, what's your insurance? How does it work? What does my insurance cover? All of these things. So for a lot of people, as soon as you say, well, we're out of network with your insurance, they're like, oh, that's done. I don't even want to hear anymore, because my mind says that's not right. It doesn't work.
I'll even bring it one step further, is that most people think that doctors won't see you unless you have insurance.
That's true. That's very true. A lot of people think that. And what they don't realize is, for the majority of the people, now there are, like there's people that work for the union that everything's covered. And there's some people that have Medicare and a secondary that they're used to everything being covered, which is fine. But for the majority of us that don't have those, it actually saves so much money by going through a direct care route. And I can give you an example. I have a patient that needed a surgery. We have a surgical room set up, a little surgical suite in our office. So we do a lot of office procedures. We can do a surgical procedure in our office for $1,400. That same patient that we were considering going to the hospital to do the procedure contacted the hospital, said, hey, how much would it cost me with no insurance to do this procedure at the hospital? Just to walk in the door, they wanted $9,500 for the same thing that I do for $1,400 in my office. So if you have an $8,000 deductible or a $10,000 deductible, I just saved you $7,000 or something like that. And that's bigger procedures. Some of these other, like hammer toes and things like that we do for around $800 in the office, they want $5,000 for the patient to go to a hospital. And that's just the beginning. And then there's anesthesia charges and all that kind of stuff. So the amount
Plus,
of
it's the
money.
quality of care. The quality of care that they're going to get from the hospital sucks compared to what they'll get from you, right?
Right.
They'll be in and out. And,
right. You don't have to
pay
get
a
there
lot
2
less.
hours before
Right.
and do all that garbage. It's
And
just
sit in the hospital waiting room with all the, with your mask on because you don't want to catch something.
Yeah.
It's just that's crazy. And I totally get it. But that's what people think. Like if I've got I got to go to the hospital.
Right.
Okay, I get it, and I think most people get it. So now, really, it's what you said is like, how do you educate people? How do you get people that aren't necessarily looking for that?
Right.
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 So you really need to bring them in the old-fashioned way in terms of like marketing, right? You got to bring them in the old-fashioned way, and then you have to like convince them otherwise that hey, you don't need insurance, right?
Right.
And that's really the market, right? Surprise, surprise. Good thing for you. You don't need insurance when you come here, and that's
Right.
so. Tell me, guys, how have you changed the marketing to accommodate that?
Yeah, I mean, like I said, when I was told I was going to be assigned to Dr. Joel's account, back in late September, I started researching it, and I was like, oh, okay, direct care. I'm familiar with this. I have another client that's a direct care client for the most part in Baltimore, and I made a note. When I first met Dr. Joel, I wanted to ask him, what's your plan to educate, people about this? I don't know if you remember that, Dr. Joel, in our first conversation.
I do.
Like, what's your biggest pain point? I knew it was going to be that. And sure enough, it was. And we just started discussing, okay, how do we get this message out? How do we make sure that, the audience understands, what's involved now. It's a benefit for them. Is it okay if I share my screen, Tom, real quick?
Yeah, please.
To show you some, I think the visuals will help this. And again, I'm not, this is not trying to embarrass you or anything, Dr. Joel, but I had to go back to the Wayback Machine, from prior to when we got together to work. And if you look, this was the messaging that we had. This was your homepage. Yeah. So the first thing, if you remember this, one of the first things I pointed out was there's nothing on here in the hero image about direct care, really, to explain it's a skyline of, Kansas City. So the first thing I did, as we had our conversations and took notes, and the whole team was involved in this, by the way, everybody on Dr. Joel's end, which is great. And I love having that synergy, by the way. I've said that multiple times too. It's so great to have a bunch of people with the same driven, direction. And here it was. So this is kind of where we landed through conversations. Let's pull up the site now. Changed it, everything. Now here we are, podiatrist, Dr. Joel, brag a little bit, double board certified podiatric surgeon.
And you got your handsome mug there. Deal. That's much better. It's a great improvement because it shows like I'm your guy. I'm going to be your guy there, right? Like the other was, there's no connection. There's no connection to, like just having a skyline. And this message is much better. So when did you make this change?
Oh, we pushed this live, Dr. Joel, probably, I want to say it was early December, late November. Does that sound right?
That sounds about right. Yeah.
It took, we didn't do anything knee-jerk reaction, Tom. Like we literally.
No, I see it. No, it's very right in line.
Very
so did it, how long did it take for it to start working?
Yeah. I think it's been, it didn't really take very long. A couple of things that we noticed is, one is that when patients are calling now, most of them, my staff isn't trying to explain what we do because they already know. As soon as
because they've been on the website, they've educated themselves.
Right. So they know.
Fantastic.
So that's been really good. And we're definitely seeing things kind of uptick in the new patients within the last, handful of weeks. So we just hope that this is just the beginning and we just keep building from here. But it's definitely, people are understanding, people know, people get it before they even come in, for sure. Before they
love the little tab on the side, John.
Thank you. Yeah. And here's the other thing too. This was probably the most interesting component of it. I was like, if we could boil everything down, Dr. Joel, in 3 bullet points, because you got to be short and concise. What would it be? And this is what we broke down: this affordable care without insurance. And of course, it took me a while to figure out what icon I wanted here, but that constitutes cutting the red tape. I hope that conveys.
Yeah, I like that.
And the other benefit of a practice like Dr. Joel's is you don't have to wait 5 months to get an appointment either. That's a big driving thing. So immediate appointments. We can even see people the same day if it's a something that's very pressing. Dr. Joel's so great about he'll if something needs done right away, like he's gonna find a way to see you, which that just shows what type of guy he is.
Do you have any content have you had any content yet about the hospital experience? Like why you would want to choose going to Joel's practice over going to the hospital?
No,
I think you should do something like
awesome
that.
Yeah. We actually,
I think you should, why go to the hospital? Yeah. Right. You know what I mean? Like,
absolutely.
Why do that to yourself? And then just talk like what we just talked about, like just go on and on, Joel, about how all the terrible things that the hospital will do. And let me ask, nobody gets excited to go to the hospital and like, boy, I can't wait to go to the hospital, right?
Unless you're a surgeon, right?
Right.
Some cheddar.
Unless there's something wrong with you, but I mean, but you can get excited. Like, I get excited to go to my doctor, right? I have a relationship with him,
right.
That's the other thing too. Is that they build a relationship with you. And what's going on with them, their history, and you'll be there for them if anything goes wrong down the road. It's no different. Like when I had plantar fasciitis years ago, I went to Piscataway, New Jersey to go to my friend, Dr. Peter Wishney, because that's who I trusted. I could have gone anywhere around here, right? But I trusted him. I took the train up there. We actually took video of it. We made it a double video. It's pretty funny. It was a pretty funny video. But he fixed me, and he fixed my plantar fasciitis. I couldn't believe it. It had tortured me for years, and I never forgot that experience, how pleasant it was, and it worked. And he's always been there for me if I had any questions about it or about other stuff. Yeah, and that's what you will not get
at a hospital. Yeah,
in a hospital, or even at a practice that is like completely bowed down to the insurance companies, as you said, Joel. That they're gonna get 5 minutes of a doctor, and they don't care.
Right. And that's another, and on that same line, no matter how good a practice is trying to do, everybody in the typical practice knows that they only get paid if they've checked all the boxes and filled out all the forms and done all this stuff. So much of everybody's time, from the person that checks you in to you talk on the phone, it's what's your insurance information, all this stuff, everybody's doing that. When you come to an office that doesn't have to deal with that, the only thing everybody in this office cares about is getting you better. That's it. We don't care about anything else. And people feel it. They can tell it, from the time that they are talking to the staff on the phone. They're just asking them, how fast can we get you in? What are your needs? How can we get you better? How can we accommodate you? If somebody calls, 99% of the time, somebody's going to answer the phone, and they're not going to get on some message machine. And if you do, somebody's going to call you back right away. You're not calling a doctor and then you wait for 2 days to see if somebody gets back with you. It's just a whole different thing, all oriented around patient care.
I love it. And there's nothing more annoying. And this happens to me when I go to a new doctor or whatever for something. The first question when you call, you're like, hey, I'd like to, schedule an appointment, and 9 out of 10 times that receptionist is rude and doesn't give two craps about me making an appointment. The first question out of their mouth is what?
What's your insurance? Yeah,
that's the first question out of their mouth.
Yeah,
and
I can vouch,
goes down from there.
Right.
Yeah, I can vouch that Dr. Joel and his crew is a special bunch, honestly.
Yeah, but that's the thing.
Sincerity,
it's like, right?
Just desire, and just the simple courtesy, politeness, courtesy with people. Like I hands down, you get my seal of approval, Dr. Joel, on that.
Well, we appreciate it.
I do want to point out one other thing, Tom,
yeah.
in regards to the marketing for this. So, talking about, testimonials in current clients or current patients, I should say, that is like the biggest social proof in the world to me, when somebody has something great to say. So when we were digging into this, how do we get our message across to people? Dr. Joel had some very good client care testimonial videos. And so one of the other options, and you won't see it on this page, but this is like one of those cooking shows where you have everything baked already. If I go to this other tab, you can see there's a pop-up that we created with this amazing testimonial from one of Dr. Joel's patients.
Oh yeah, that popped up for me.
Yeah. It'll pop up. I think we said it.
That's great.
Yeah. And so it's just,
that's so smart.
I got to tell you, just in the past 30 days alone, I think I have this pulled up already. Yeah. That video alone has had 138 views with 120.
I would, but I want to see you do a good piece and campaign about how terrible the hospitals are. Like you got two campaigns here. You have many campaigns, but two right here that we like. One is how terrible the hospitals are, and two is how terrible other podiatry practices are that take insurance.
Yeah, I don't want to say it that way, but I know what you're saying.
But you can say it just the way that we did without calling out anybody, but it's a choice, right? I mean,
right.
And that's what
in their defense, and I have people, believe me, we see people all the time that have gone to 2 other doctors, 3 other doctors, and they're like, oh my goodness, you guys do everything right, everything's great, why doesn't so and so do this and all that? And I say, in their defense, they're probably trying and they probably want to, but they can't serve the insurance company and serve the patient at the same time. They have to pick one, and the insurance has to come first because that's who pays them. You're not paying them, so they have to jump through all the hoops they want. By us stepping out of it, it lets us do the things the right way. So I think a lot of people want to do it. They just can't.
There's other big things, intangibles. The detail of what you're saying is really important because your model allows you to have more resources for client care.
Right.
Because your profits are better to put back into your own practice by hiring better people, right?
Right.
Better staff, better equipment, and you're able to give better care. Like you said at the beginning, like your mindset has changed. You're able to, instead of being frustrated, instead of being like working for the man, and you're able to get better care. That's the other thing too.
Right.
And that's really what I want to get across to everybody here listening is that, this is something that everybody can do. You just need to know how to do it. Joel's a perfect example of somebody that's been through the fire, just like you have, that made the tough decision based on he wanted to have better quality care for his client. I think that's the attitude that has to come first to make this work. You can't look at it like, this is a cash cow, I'm going to do it that way, without having the attitude of I'm going to give better care to my patients and take that additional revenue and invest it back in the practice like you have, Joel.
Right. Yeah.
I've got to add this, and Dr. Joel, like he doesn't only just talk the talk, he walks the walk too. He strictly believes in direct care for everybody, to the point where we're actually letting everybody in Kansas City know who else takes direct care. That's how much he believes in this. What other primary care physicians chiropractors, dentists, what have you.
That's brilliant.
So we're trying to get the word out, not just for Dr. Joel about this. We're trying to get the word out that there's all kind of other practitioners that have embraced this model for the same reasons, that Dr. Joel has. So, and if there's anyone in the area that's listening to this, the Kansas City area, let us know if you want to be part of our directory, because
you should list other doctors in other states too that do it, man.
We're trying to get the word out and educate the public about this. And then
put Eric on there. Put Eric on there.
Absolutely. I just met with Dr. Eric earlier this morning. From Baltimore Periphery. Great guy, great nerve surgeon. Dr. Joel, I have to ask your permission before doing this, because I was a little giddy when I saw it. But do you mind if I just show some numbers of yours, traffic numbers?
You can show whatever you want.
Okay, because this is the stuff, I live for this. Like, it's so exciting when, and I have to say this too, having a client like Dr. Joel, where the whole team's involved, like, it just makes a world of difference. I mean, it really does, because as a marketing strategist, I'm not isolated. I can bounce ideas off people.
Yeah, you got resources. You got people to help you do your job.
And I just want to show how well this is working. Okay. And we'll try to keep it to a minimum here. So from roughly around the time this is from the first day I started with you, it was October 7th, going through my notes. Okay.
So John, really explain real quick to everybody what are we looking at?
So this is a report that we generate for all of our clients. It pulls in real-time data from Google Analytics and Search Console and what have you. But here's what we're looking at. In this time period since we started working together up through yesterday, we've had 18,000 users, and they're mainly new users, obviously, which is what you want. You want new people coming to your website. You know what I mean? Multiple times coming to the site. But here's the beautiful thing. This little green number here, that's how much it has increased from the period prior.
So you got 14,000, almost 15,000 views.
It's, to me, and Dr. Joel, again, like when we started
with 28,000 views to your website in this time, and 15,000 more since before you implemented this.
Right. It's pretty impressive. And I just wanted to share that. And the reason I'm pointing that out is this works. Okay. Like when you can strategize and you can implement and everybody can brainstorm and you put that into motion, I'm telling you, at the end of the day, like it's going to work for you. It's going to work. I mean, in the first,
but you have to have all the parts, as John is saying. Like you first of all, you have to have the commitment like Joel has.
Yes.
And you have to have the right attitude. You have to have the right attitude. You have to work with a partner that can execute this for you. And guess who that can be? That's us. We'll help you do that. And make those changes that need to be made and stay on top of it with additional content, a lot like what we just talked about. And you got to come up with new stuff all the time. I love having your testimonials and your results up there like that on video and pop up like that. This is brilliant. So that's great stuff. And I know you're just getting started.
Yeah. I feel like we've made a really good transformation. I mean, kind of going back to the beginning of all this, when I really wanted to do this, I was actually working with another company that was doing my website, and I talked to them and I said, hey, this is what I want to do. I'm going to step out of insurance. I really want to make this change. And they were like, oh no, don't do that. That's not going to work. It's not a good idea. We don't think you should do that. Let us help you. We can make some changes, and I'm going to get you in contact with somebody else and all this stuff. I immediately called you guys right after that conversation. And I think I talked to Chad, and he was like, oh man, we can make this happen. We're going to do it. It was like 180 degrees. It was like complete opposite. It was like, hey, we can do this. We can come up with a plan. We can do these things. And I was like, okay, this is it. We're doing it. In the beginning, we were just kind of trying to make a good website and change everything around. And honestly, it was good. Everything was good. But we've really, since John's been on board with us, have really just taken this up a whole nother level and said, now let's direct this marketing strategy, not just to kind of who we are, but how this works and what direct care even is and all this stuff. So it's been great for us to just see, not only working with you all, to just say, yes, we're going to help you do this, not no, you can't do it. But then always pushing to say, you know, we're not content with, hey, your website looks pretty. What do we need to do? How can we get more patients? How can we continue to kind of build this thing? Because it is frightening. I mean, it's scary as whatever to drop everything you've been doing for years and everything people tell you that you have to do and say, we're going to do something different. It's like starting your business all over again.
Sure.
And so, you know, it's taken time to get to this point. I really feel like we're right on the verge of just really exploding this thing. We're just like we're seeing those numbers. Too. I mean, we had 6 new patients on Monday. We had 4 new patients yesterday. I think we had 4 or 5 on Tuesday. So
keep it going. I love hearing.
I love it, man. That's fantastic.
So exciting.
So you know, that's the best beginning of a week we've had in a long time, you know? And so I don't know, who knows what next week's going to bring, but you know, that if we can keep building on that, you know, we're going to get somewhere for sure.
100%. You guys have email campaigns going out to your list and all that, John?
Yeah, well, we're going to do one on direct that's coming up.
Like your direct care,
all the information
patients.
Yep.
Yeah, we have
refer other direct care patients.
Yeah. And we're also marketing to all these other direct care doctors in our area. We're sending information to them, not only just to kind of let them know what we do. Like, for example, we have a CT scanner in the office. So I can do weight-bearing foot and ankle CTs for $249, which is nothing compared to what it would cost you to go to the hospital to do it.
Sure.
But a lot of these other doctors don't know that that's available. So if they have a patient that needs a CT, they're like, well, let me send you to wherever and see what it's going to cost. So to let people know we have those services.
That's smart.
Orthotics, you know, people that are going to these stores that I don't even want to talk about.
Don't mention it. Don't mention the name of the store.
Yeah, but those guys, man. Those guys are marketing juggernauts, man.
They're scamming people, and we're like, hey, we can do it for only $375. Come here and let us do it. And you know, so we're marketing to other direct care providers, and we're just at the beginning of that, because with the page that John was showing about how we're going to really try to promote these other doctors. Our goal is to start doing interviews with them about their practices and how they work, and really just trying to grow a direct care community starting here in Kansas City, and then see where that goes.
Yeah. And you know,
you will never get good service from a company.
Right.
It's rare. You know, like we're actually surprised when we get good service from a company. You know, when you walk in there and they like treat like Apple Store, right? You know, they hold up. They've held up over the years, you know, in terms of customer service and all that stuff, and they've gotten better and better. That's one place where you walk and you're like, wow, I feel good about how I was treated in there, even though no matter what, it's busy as hell. You know, they got great staff. But you go into like another big corporate conglomerate store, they don't give 2 shits. No. You go to them, you know, that's why I go to a tailor, right? To get my clothes tailored properly, because I'm not going to go to like Nordstrom's where that guy's getting paid, you know, $12 an hour and could care less about you.
And I've met your tailor. I love him.
Right?
Yeah.
We do his website.
Yeah. Love him. Just well, anyway, the character, he's great, but yeah.
It's about the quality of service that you provide, and really, if you are one of those kinds of people that is a doctor that is struggling with this very thing of, I'm not able to give the quality of service to my patients that I want to, This is an avenue, and this is the best avenue to do that, and also take care of yourself.
Right. Yeah.
Well, great job on the pivot. Great job on the pivot, Joel, that you made that decision, and I cannot thank you enough for choosing us and trusting us and relying on us to do this for you. This is a big, big, big thing, and we don't take it lightly, as you know. We're in it. That's why I wanted to bring John in on this podcast so he could talk about, you see John's enthusiasm.
Right.
He is, we're like you. We're not a big corporate company. We're hands-on. We care about you like you care about your patients. We want to make sure that you're successful, that you reach your goals, and that's why we're constantly pushing. What are the next goals? Okay, we achieve that. What's next? What's next? What's next? How can we make it better? What's next? What's going on? And so,
and I want to add to the group effort aspect of it. Like it's
right. You can't do it without them.
I mean, Julie and Hannah are boots on the ground too out there, like visiting practitioners and giving them information about, working with Dr. Joel, direct care, what have you. I mean, it's just a beautiful thing, when you have a team that can put together.
Well, and there, especially when you're a doctor and you know how to treat patients, but you don't know what to do, like any of that. And for me, those two, like Julie and Hannah, they're like, okay, we need to do a video about this. These are the things that we want to
do. They know the social media part. Right.
Here's what you do, and I kind of do what they tell me to do, and and
they're working with patients and taking calls and juggling all the other things,
and that's what
delegated.
But it makes it work too, because exactly what you said. Julie's answering the phone. She knows what people are saying when they call. Hannah is an MA at the same time, so she knows the experience that people are getting in the back. So they're not just marketing; they're in the middle of it at the same time, and it really works.
Yeah, absolutely.
And that's another thing too, is the quality of your staff. That we're talking about, like these other practices in the hospital. Those people are not there because they're there to make a paycheck.
Right.
They're there to make a paycheck. They have not bought into the idea of we're here to help our patients. I'm not saying everybody's like that, but for the most part, that's what you find. Like I was saying, receptionists answer the phone. What's your insurance? They don't care.
Right.
They, not even, well, what's bothering you? Like, could that question come a little later, maybe? Like after you find out, like if I'm worthy of, coming in there or whatever.
Right. Yeah, that should be the first question.
Yeah.
What's the issue and how can we help you get it better?
Right.
That's where it has to start.
We'll worry about how you pay later on.
Yeah.
Let's get you fixed up. Right. Well, that's the ticket, man. And Joel, great job to you. And like I said, thank you again for trusting us to help you do that. Looking forward to many years working together and making you more and more successful. And we're not related, everybody, even though we all got the same last name.
I know.
Yeah. I mean, like that's magical. And that's probably why you're so successful, right?
It's got to be. The last name is the ticket. That's it. So good luck to everybody that's not have a last name of Foster. Hopefully you can do okay. But
right. Can never be as good, but
that's right.
Almost get there.
Yeah.
All right,
thank
everybody.
You for sharing your story, Dr. Joel.
Yeah, thank you, Joel, for sharing your story. John, thank you so much for jumping on. I know you're a busy guy. And everybody, thank you so much for tuning in to the World of Marketing for a special edition with my buddy Joel Foster, Dr. Joel Foster. Thank you so much again for your time.
Appreciate you guys.
You guys have a wonderful day. Hang out. Don't go anywhere.
All right. Thanks.
All right, everybody. Take care. Thank you.